So welcome everyone. We're so excited you're here to our very first Lunch and Learn series. This is a webinar that's meant to be really engaging for our members at independent, rural, and critical access hospitals. We are affiliated with ARM, and we are a national coalition that just launched in August. And I'll be handing over to Mark Litton, our co-chair, to explain more about the organization. But just to say, this is our first of our series, and we're so excited to have you. We would also love your feedback afterwards, so please keep in mind any other suggestions you had in service of growing the group. As we get started, those of you joining, please post in the chat your name, the facility, and state where you're calling in from. And then we would love to hear your experience with value analysis, be it 0 to 5, and any other key questions you had to start. All right, so Liz, do you mind going to the agenda here? We have several of our presenters for today. We will hear from Mark Litton, our co-chair of the organization, to introduce what this group is and what you can expect from us. Myself, Rose Marderstek, I'm the communications chair for the group, and so I'm running the call. Then we will hand it over to Liz Fakina and Cameron Rickard. They are going to speak on value analysis. So Liz Fakina, the director of value analysis at Parkland Health, and Cameron Rickard to speak to his experience of actually launching a program at a small rural hospital here in Montrose, Colorado. We will then have time for Q&A at the end. So that will be a forum moderated by Jeff Borgstrom, who is the VP of National Accounts. And we will hear from all of you about what you want to see from this group going forward. With that, I'll hand over to Mark to introduce the group.
Thanks very much, Rose. You're an absolute rock star, as always. I just wanted to take a quick second to say my sincere appreciation for everyone joining this call right now. I know definitely how difficult it can be to take an hour out of your day in the middle of it, and it's really appreciated that you guys are here today, helping support what we're trying to build right now. So my name's Mark Litton. I'm the co-chair of the Independent Link Coalition. I want to take a couple minutes just to give a quick overview of who we are, how it started, and what we're really trying to do here, what we're trying to grow. We really started this about 6 months ago in Denver. Our goal is to be a group of people that's specifically designed to better support supply chain leaders from independent, critical access, and rural-based hospitals. We talk to a lot of you guys, and we consistently hear that in your roles at independent hospitals, you wear a lot of hats and you work in complete isolation. It's a lot different than the bigger hospital systems out there that ARM typically supports. You know, a lot of those larger systems got 100+ people in supply chain. We're talking to you guys, it's 5 people max. A lot of teams have 1 to 2 people in total. And it's just a different experience for you guys than it is for the larger health systems. We kind of took a look around the industry to see which groups were specifically trying to support this ecosystem, and really didn't see anyone out there. So we wanted to address it. We wanted to fix it. Our goal is to support you through education, networking, and support in collaboration with ARM National and the various chapters throughout the country. And so really, as Rose alluded to, 6 months ago, we got together in Denver. We got 20 supply chain leaders from around the country to go to Denver for ARM National 2025. And it was at this point that we kind of sat down and said, what would support look like to you? What can we do as a group of passionate supply chain leaders to help support you guys in your roles, in your hospitals, and in your communities? And then we got to work. So we've been really busy since then. Coming out of Denver, we officially have a leadership team. We've built a community platform, and we also, as of today, have started our Lunch and Learn series to provide that type of education. The one thing that I want to highlight the most is the community platform itself, the Circle page. So a lot of times we've found that you go to networking events, you do Lunch and Learns, you get all this education, you meet a bunch of really cool people, and it's all a lot of fun. And then it's over. It completely stops. There's no continuing to it. Maybe you see him again in 6 months at the next national meeting, but really the conversation just kind of ends. There's no continuous learning when it comes to the content that was covered. And we want to address that. So our goal with the community platform page is that people can go there, join as members, and post their challenges, post their issues, and get real-time feedback from your peers around the country who've probably had the exact same experience and have learned to deal with those issues. So instead of working in isolation, you feel supported by a group of individuals that are as passionate about what you're working on as you are. If you want to go to the next slide, I think there's one great example that we have that highlights this really well. So Josh Day is a friend of mine. He's runs materials management at Sierra View in California. A couple months ago, he got tapped on the shoulder by a CFO, said, "Josh, I've been hearing a lot about value analysis. How about you go ahead and just figure that one out?" And Josh said, "Of course, that's what we do in this role. We say yes to these things." The only thing is, he'd never done it before. He did not have a lot of experience when it came to value analysis. So he did the really smart thing and posted it into the Circle page saying, "Help." That's my interpretation of what he wrote. Immediately, within 24 hours, he got responses from 11 different people within this group to offer their immediate support. Happy to jump on a call if it's helpful. People gave him frameworks, they gave him templates, they gave him phone numbers. Mike Schiller is the executive director of ARM. He jumped in to say, "Here are some resources that ARM National has already done." It was a really overwhelming, positive experience. It was really fun to follow up with Josh afterwards and be like, "How was that experience for you?" He goes, "I didn't know what to expect, but that was crazy. It saved me weeks of research. I got a bunch of connections. I have friends from this now that I can call up on a dime and just say, 'How do I go about this?' And they answer. And some of these people are lifelong value analysis people, as you will see in the coming education here. And really, I just thought this was a great example. It highlights what can happen when you bring together dedicated, passionate individuals that are like-minded, that have the same goals. And you can bring these people together, great things happen. And again, I'm just really pumped about the execution of this. The team here has been hard at work. It's been a lot of fun. We really hope that you join the community, that you post your questions, you support where you can, you tell all of your friends, and we're really excited for this to continue to grow. And again, just very appreciative to be here. Appreciate that you guys are all here.
Nice. Thanks so much, Mark. We appreciate that. That was a wonderful summary. We're going to hand over now to Liz Fakina, our value analysis expert, to walk us through building a program.
Hey, thank you. So value analysis I'm Liz Fakina. I'm director of value analysis here at Parkland. I've been doing value analysis for a very long time, not a lifetime. I was a bedside nurse as well, but I do have a lot of experience pre-value analysis platform and technology. So revisiting some of what I used when I first got started in value analysis, I've kind of built for a bunch of resources for the group here and breaking it down to small steps because it is a big undertaking. So what is value analysis? It's a structured approach to assessing the value of new and existing products within your healthcare setting to find the absolute best value. So it's not just money, it's not just cost, it's a lot of things. Healthcare is a business, but a business like no others. So we're talking about the effect on patients, the effect on workflow, the function of an assessment of whatever it is you're looking at. Cost reduction is, of course, important, but efficiency improvement, what's the effect on workflow? What's the effect? What's the overall value? So we can equate all of our healthcare outcomes into a dollar amount as well, but you cannot put a price on good quality care, efficacy, and safety. So the overall profitability or impact on cost, quality, and outcomes. That is what value analysis looks at. It's an evidence-based, data-driven approach to looking at products, technologies, and services. And we're going to walk you through each of the steps and break it down for you. So we looked at how do we affect change within an organization? There are a lot of different change mechanisms. So what we did was we looked at all the different steps within value analysis, how to build a program, and we broke it down to 8 steps using Kotter's change method. So we're not going to cover in detail all of the steps today. We're going to give you enough information and resources to really get your program started. So step 1, establish a sense of urgency. So within the healthcare environment, folks are already talking about how do we save money? Are we doing the best? So just as this group recognized the need for a value analysis program, they see the value in instituting best practices and creating a structure, building or formulating a guiding coalition. So that's working with your C-suite, your senior supply chain people, or in most cases, it's only 3 or 4 people in supply chain. Looking and identifying your key department heads within your organization Who are your decision makers and drivers? Who are your key influencers? That's who you need to get involved in your value analysis program and process, and that's who you want to lead it. And getting that executive support is key to success. Develop a strategy to bring about change. So there are evidence-based value analysis processes, structures, committees, suggestions about who should be on your committee, which type of members you need, charters and policy, branding your documents, supply chain value analysis. And we've given you a lot of templates to get you through that stage. The next would be communicate. That's putting forth a broad vision for strategy for change. So you're pulling your value analysis process structure and templates you're starting to introduce to the organization. I've got for you a roadshow, which is a value analysis PowerPoint that at the same time helps educate and introduce. It helps engage and gets people involved in the value analysis program, as well as a fact sheet. So education and engagement is an ongoing process. And then empowering on broad-based action. So this has to be a top-down approach. So without key executive support, budget owners, organizational leaders, your program won't be as successful as you would like it. So that announcement that your program is going live and that there is a value analysis program comes from your executive team, utilizing things like your intranet, your internal websites, SharePoints, etc., and what your meeting schedule is. Generating short-term wins. So right now, everyone, no matter how big your organization is, whether you're 100 beds or 1,000 beds, you've all got a list of requests, things you're working on. So generating short-term wins, looking at these things, using the value analysis process and templates and introducing them through your committees, easy conversions, your low-lying fruit, show your success stories. Next is sustain, never letting up. So look for other opportunities to expand with your supplier partners, with your different hospital committees, your GPO, if you're involved with one. A lot of the smaller organizations are not. Involve all of your departments. And lastly, incorporate new and better changes into the culture where the value analysis team and process becomes embedded throughout the organization. So we're just going to break that down for you. So as with anything that you start, you need to know, where am I now? What does my process look like now? What does excellent look like? So just a basic gap analysis. Where is your value analysis in terms of, do we have any decision-making groups now? How do we look at products, technology, and services? And which level of maturity are you? So there are several models of this out there on the internet, and I've given you a lot of resources, but having your starting point and assessing where you are now is extremely important. And you know where you want to go, which is the future of value analysis, where you're fully embedded, cost, quality, and outcomes, using data, fully engaged, enterprise-wide, with everyone involved. So creating that sense of urgency again, how does a value analysis program really impact the whole facility? It goes beyond just your individual patients, end users, departments, and facility. It actually reaches out into the community as well. So it makes a difference to patients, providers, giving them better tools, technology, cutting edge equipment and services, improving workflows, better reimbursement, makes a difference to your suppliers and society. Basically, your value analysis program is going to impact your entire healthcare system and community. And these are just some of the things that, we'll take into account as we try to get our value analysis program up and going. So the benefits of a value analysis program: meeting your customers and your end users at the intersection of cost, quality, and outcome. So the benefits of a value analysis program are, again, that enterprise-wide culture that gets everyone engaged, excited, and involved, where everyone knows there's a value analysis program. Here's who it is. Here's the process. Here's how I reach them. It reduces waste, improves utilization, of course, increase efficiencies and workflows, improves standardization, not just of products. So for supply chain, we'll have less products on the shelf, and that'll be more efficient for us. But when we change and standardize products, technologies, and services, we also streamline and standardize outcomes. So we're not making these decisions in a silo. It's with our entire clinical group looking at all of the impacts, cost, quality, and outcomes. We want to, it'll be a big improvement in the continuity of care and standardization. So quality of care, patient safety, patient outcomes, and increasing the satisfaction of all of our engaged parties. Oops. So step 2 is formulate a guiding coalition. So within your own organizations, I can't tell you exactly how to do it because it's specific to your organization, the size of your organization. If you have a 15-member C-suite or just a few people at the top of your organization making decisions. So whoever your executive leaders are, that is who you need to engage and discuss this value analysis program with. So they will help you identify your key decision makers and drivers, find you co-chairs, who are the change agents within your organization, who are the influencers, and who are the people who can really empower and motivate the rest of the staff to be engaged. They will help you with your committees and structure. So how it looks in your organization, the smaller rural hospitals, will be different than how it looks like at an NYU or a Parkland. But you may have 1 or 2 committees that meet once a month, or you may have an entire structure that meets monthly. You may have just a meeting where you're meeting once a month and you call in your end users as it's applicable to their service, depending upon the opportunities. So your structure in the committee, you want to include all the areas specific to your facility. And you look at whatever if you were to go to your company's intranet site, your whole program aligns with the strategic goals of your organization. So the value analysis program, process, vision, policy, charters, all of that is created in alignment with your culture, your mission, your vision, your policy, and whatever your strategic plans and the goals of your organization are. So we're just going to quickly review. This is what a typical in a moderately sized hospital. Your steering committee is your executive leadership. Somewhere in between here, a lot of people have another bubble for supply chain, the folks that are actually behind the scenes doing the work. But the areas of the hospital that you always want to involve, big money areas, cardiology, radiology, OR, your medical, surgical, nursing, your business operations, your labs, and it, again, specific to your organization. So your steering committee, they're your C-suite people. They're your executive sponsors. And without their support and buy-in and helping you, your program will not be as successful. So this is a key piece. So what does the steering committee do? They establish priorities and goals. Again, they'll sign off on all of your documents, your value analysis charter, your policies. They'll help you with that. They'll engage the right people to approve those. They ensure that your value analysis goals are met. They'll help you with the value analysis goals. They'll remove any barriers to your program success, and they'll continue to support you and promote the program. Your value analysis committees. So the committee members and roles, you can actually translate these documents into a member agreement. So we have one for chairs and co-chairs, and we have one for the committee. So what do the value analysis committees do? They use evidence-based practice They look at data, cost, quality, evidence-based research, compare what we currently have, and they identify cost savings opportunities to look to continually build upon the current process and collaborate in reviewing and evaluating decisions, participate in all meetings, and they serve as role models and champions of value analysis. Your value analysis chairs the pre-meeting, usually the value analysis committee, my team. We prepare all of the slides. We work with the vendors, we work with the end users, we look at the evidence, we prepare all of the slides, prep the chairs, co-chairs, and the presenters, and then they present it. So we are the value analysis team. We are directors and managers with no decision-making authority. The decision-making authority and the decision process and review happens within the value analysis committees. So the chairs are responsible for the agenda and topics. They help set the goals. They ensure the meeting is well managed and stays focused. They collaborate with the value analysis team and with the executive sponsor. Now, right now, you have sources of opportunities. Somewhere you have requests coming in. You're purchasing, you're reviewing, you have
Hey, man, I've been in meetings. I saw your phone call and I just literally.
thanks.
Please continue, Liz.
I'm good. Yes, so sources of opportunities are coming in. But when the committee looks at sources of opportunities as through the value analysis process, the patient is always at the center. So everything we do is centered on how will it affect the patient. So we have the executive team who's looking at that. What is the data? What are the evidence? What are we currently using? And another very important thing that we look at is our quality dashboards, our metrics. Where are we now? Will this product, technology, or service improve outcomes? So we work very closely with the clinicians and providers when they introduce products and getting their feedback. The committee is the actual one who votes and make the decisions. We just put the right people at the table and the right information on the slides for the committee. Supply chain is extremely important. We learned a lot about that during COVID. So if the hospital is the human body, the supply chain is the muscle. So the body can't work without the muscles. Supply chain is extremely important through this process and throughout the introduction and to keep this going. So your opportunities may come in many forms. I just put a few that the smaller hospitals may see: product requests, business reviews, partnering with your supplier partners. If we look at a supplier as, oh, here's this guy trying to sell me something again, that's kind of a barrier that you're creating. Your suppliers, when you sit down with them, you should have someone clinical there, your value analysis nurses or team or physician, to really understand not only the contract and the cost, but the value of what it is they're trying to bring to your organization. Your opportunities may also come from regulatory, safety-related changes, practice changes, and data analytics. Post-COVID, you find out you have, 16 specula or too many of one product. That's a standardization opportunity. All of these can go through your value analysis committee using the value analysis process. So I want to mention AVAP, Association of Healthcare Value Analysis Professionals. Most of us in value analysis belong to ARM and AVAP. They have a 5-step process. So identifying your opportunities, looking at what you have now, how is it working? How is it affecting outcomes, workflow? What else is there out there in the market? Gathering information, evidence, and data, looking at your analytics, looking at your evidence-based practice, looking at what else? Comparing all of your different technologies, all the way through to piloting and trialing, and then monitoring the success post-implementation. So value analysis is a pretty big detailed process. So what we've done is we've broken down these steps into a checklist, and the checklist is in Word format. And all of these documents are resources for you. So we've given you examples of a value analysis structure. So this is dropped in the Circle app under value analysis. We've got a lot of resources for you there. We've got a sample charter, what the elements are, a sample value analysis policy, what the elements are, a product request form. Everything's in Word format. Take it, put your logo on it, make it your own, revise it specific to your facility. Sources of opportunity, I put together an Excel tracker. We use that in my current facility. Every 2 weeks, the entire supply chain is on a call that we review all of our value analysis opportunities. So we want to sort those by priority, complexity, and populate the spreadsheet just to organize yourself. We also sometimes use portions of the spreadsheet to put on value analysis slides to update the committee. We have a price file template for you, a value analysis fact sheet to help educate your folks on value analysis. We have sources of evidence, but you're not expected to be a clinician. I don't know the answer to everything, and I'm not the clinical expert in everything. My background is adult ICU, but I know who to reach out to. So anyone who has gone to nursing school or medical school, even in the associate degree program, part of their job and work is learning how to interpret research. So Barbara Strain and I put a list together, and I posted that in the resource, all of the different links that you can look at for research. I've also got some online free resources to help you educate yourself about value analysis. So of course, ARM is on there, AVAP is on there. The different GPOs which outline value analysis programs. We have Vizient, Premier, Health Trust, and Dee Donatelli has a very nice program that she put together for Simpler on value analysis. So lots of resources. Rather than say, hey, Google and find these yourself, I found them for you and put them in the resources. So this is a really good start to the first steps of your value analysis program. And I look forward to hearing how you did with all these resources. But never stop growing, helping, and achieving, because there is no substitute for hard work, ever. Just don't give up. And I am going to hand the presentation over to Cameron, who's used some of these resources to tell us his value analysis success story.
Great, thanks, Liz. So again, my name is Cameron Rickard. I'm the Value Analysis Program Manager here at Montrose Regional Health. We are a 75-plus bed independent nonprofit hospital here in Southwest Colorado. So hoping that some of these hurdles and challenges and successes that we kind of walk through here will resonate with some of you as well. I've only been here for about 7 months at Montrose, but again, just wanted to walk through our value analysis journey and take you through that. So, and we'll be looking at the challenges and hurdles that we faced when we first started to revamp our value analysis program, changes that we've made to improve those processes into where we are now, and then what's next as we continue to grow and sustain this program moving forward. And so where we were when we first started to revamp our program here, we really had a leadership void for value analysis before dedicating someone to really run the program, or at least having it be a key responsibility of their role. We had multiple people who were trying to help out and run the program, and as you all know, you all have your own roles and responsibilities, and it just wasn't getting the attention that it needed and deserved to be successful. And that really led to lack of information and direction. So without somebody managing that program, we didn't have a process flow established, and really the team here wasn't aware how value analysis operated, both from an overarching standpoint and from a granular aspect of even how to request an item for review, who to reach out to, and how the committee meetings should run. And so our committee meetings really ended up being more loosely structured and being driven by our vendors. And as Liz mentioned, our vendors are still very valuable and have a lot of great information, but they ended up feeling more like a sales pitch during those meetings, and we weren't really getting the necessary discussions between our caregivers who were requesting an item and are the experts in that item, and then the committee with the full evaluation and getting the information that we really need. And so even though we didn't have, oh, sorry, Liz. Even though we didn't really have much in terms of value analysis, process information, and documents, we also didn't have a centralized location for our caregivers to go and access these documents that we did have, at least, and if they were looking to get, become more educated on value analysis and how it works here at Montrose. And so where we are now in kind of our current state with the changes that we've made, we have a clear and defined value analysis process. So we've established a clear process flow, and we've created additional process documents to clearly outline how value analysis works at Montrose Regional Health. We've made improvements to our item request process and our research, how we do our research here. So we've created and implemented new tools. We have a new item request form that we just used through Microsoft Forms, which is a easy way to create it, easy way to change it if needed on the fly, with all the improvements that we've made since then, and a good way to collect and store that information. And then we also have a new, we call it an item evaluation form, really for our research, to have a standardized list of questions that I can start out with when I'm researching a new item. As Liz mentioned, we're not necessarily going to be an expert on an item, and I don't have clinical background in my background, so especially for me, it's important to know where to reach out to and what to start with to really become fully aware of what that item is what it's meant to do. And so our committee meetings at Montrose Regional Health, we have, if you want to back up just one slide, Liz, thanks. Our committee meetings, as mentioned, were originally kind of run by our vendors, and we've actually stopped inviting our vendors to the committee meetings. Again, those discussions weren't normally very helpful, and it was especially awkward if a competitor to an item was also being presented. And so our committee really now is driven by our caregivers who are requesting an item and are the experts in that item, and along with myself to help try to provide context from the research that's been done and trying to show that in an unbiased way as well. And especially if there's another item that maybe the caregiver didn't know about that is out there as well that could do something even better than what they originally requested. And then we didn't have that storage location for all these value analysis documents. And then now with all of these new tools and resources that we have that we've created over the past few months, we really needed somewhere to store these documents and allow our caregivers to have access to them. And so an easy way for us is just using SharePoint for a lot of the back end and keeping everything organized. And then from a forward-facing aspect, having our forward-facing documents on our hospital's intranet page and easily accessible for our staff, again, to learn more about value analysis, or even if they're interested in joining the committee and learning about that as well. And then where we're going as we look towards the future here, there's many challenges that we could list here, and we're certainly not in an advanced stage at this point at Montrose, but we're moving towards that intermediate stage and looking to take those next steps. And three of the major challenges that we currently have and that we've been working on, one being that we don't really have a post-value analysis follow-up or evaluation. That's really a big next step for us to help determine if an item that we've approved through value analysis is actually doing what it intended to do, both from a financial aspect, if it was a cost savings opportunity, or connecting with the team that's actually using it and determining, is this doing from a real usage and capability standpoint what we thought it was going to do. And so then, sustaining and growing our value analysis committee meeting participation is another challenge for us, and just making sure that we're communicating to the hospital as a whole all these changes that we've made and have been through over the past few months. We've started to present our process to our leadership team, just making sure that they're aware of all those changes, and then also making sure that now that we don't have our vendors there at our meeting, we really need those caregivers who are requesting the item to be participants, making sure that they're required to be there. They know what they should be presenting on and what the committee is looking for from an evaluation standpoint. And then finally, continuing to introduce and add new additional tools and resources. As mentioned, we have our new item request form, we have our new evaluation form for research, but we've also started to use an item summary sheet during our committee meetings, just as an easy way to create a way for our committee to see the most important bullets of the research that's been done on an item, from materials management to infection prevention and safety and education, financials. It's an easy way for them to download and digest all of that information, because it can be it can be quite a bit when they're trying to review all this information at once. And then we also have a new item scorecard that we're testing out as well, to hopefully facilitate the committee with evaluating an item, especially if it's two competitive items. It's an easy way for them to make a decision and see what one item does well, what another item is lacking in, and make that decision more efficiently. So we'll continue to grow the program here at Montreal. Still a lot of changes that we can make here to improve and be better, but we want to make sure that we do it in a way that's sustainable and allow our caregivers to adapt to those changes that we have made as we push forward here.
Awesome. Thank you both so much for sharing your experiences. I think it's so valuable to hear about the structured building blocks that Liz shared, and then we can see those different steps applied through Cameron's experience of building that coalition, implementing the systems that needed, and actually creating that change as an ongoing process. So thank you both so much for sharing that. We wanted to share their contact information here so you can have it on the slide. Both Liz and Cameron are also active participants in our circle group, and so we can comment and share a message over there as well. And I'll drop that link into the chat. Liz, do you mind going to the next session, slide? And then we will start to do some of our Q&A. So at this point, Jeff Bergstrom, who is the Independent Link Coalition's membership chair, to engage with all of you. And so we'd like to hand it over to him to just get us started with a few of the questions to our speakers. At this time, I would also invite everyone on the call to please throw your questions into the chat. We would also love for you to actually speak yourself. So if you'd like to raise a question live, you're welcome to click the raise hand button at the top of your screen, and we'll go in order of that. So Jeff, take it away.
Well, thank you very much. And first of all, Mark, thank you for the great leadership. This group is just really going to take off and be a major asset to the facilities. And I kind of think about an ARM meeting, a local ARM meeting that I was at, and I was talking to head of a material manager at a small hospital. And I asked him, who does your value analysis? And he goes, well, I do all that. And I was like, oh, I don't think so. But I didn't say that out loud, of course. So it is. There's a lot to it. As you can see, Liz did a great job at the 30,000 foot level. That's just scratching the surface. We're going to continue to provide more opportunities and more information that will be available, as she mentioned, in the circle under value analysis. And then Cameron, really, that was a great rendition of how it gets started and how it moves forward. And so some of the questions that I have are kind of go along the lines of, getting things going needs the BiOpRM leadership. And so, Cameron, my question for you is, what were some of the successes and some of the challenges that you saw when you were trying to get your leadership team engaged in helping you?
Yeah, no, that's a great question. I think the successes, which I mean is part of the challenge as well, is making sure that you communicate early and often with your C-suite. So that's what we did kind of from the jump, is make sure that we were aligned with the vision that we had of the program, and just making sure to keep your team and your C-suite specifically involved and informed with the changes that you're looking to make, that you have made, to stick to that vision, or if you need to adjust, and if needed along the way, and to make sure that you're sharing not only the successes that you're seeing with those changes, but to show the growth and also the challenges that maybe have come up and what support you need, and clearly laying out that support you may need from them to continue that success. I think a great way to look at it too is, making sure that you're providing examples of potential cost saving opportunities that not only you may have caught at this point when an item is already being used at the hospital, but trying to avoid letting something like that happen to where you're catching it at the beginning of the process, right? So you're catching it further up the line, and you don't have to wait until something's already been implemented and realize that, oh, there's maybe something else out there that does this a little bit better, or is a potential cost saving opportunity. There still may be those situations, but if you can really kind of limit to having those caught and filtered at the beginning, I think that's a great step that we are able to show our C-suite team, and make this a viable program to start and keep going here.
Liz, any advice from your years of experience in working with the C-suite?
I think money talks. So when you show people opportunity, C-suite people think very high level. They want to save money, but at the same time, they want to improve their report card, their key quality indicators. So anything the organization can do to improve the quality, safety, and cost of care and efficiency of care, they're all on board with. So that's what value analysis is all about. And giving, like I said, right now, everyone's got opportunities in their pipeline. Everyone's got opportunities. They just haven't framed them and used the value analysis process yet to present it. We also had hopefully at the end of this slide, we had an opportunity snapshot, how we actually put the opportunities on the slides. But I agree, bringing your opportunities framed using the value analysis process, focus on cost, quality, and outcome. That's how you get buy-in.
Thank you, Liz. And obviously, to hit was triple aim, then it was quadruple aim, and now it's quintuple aim. I don't know, however many aims there are now. That's a lot of work. A ton of to do value based.
You sit on my board back here. That's what's on my board back here. That's hilarious.
So we'll have to add that, Liz, to the set of tools. But to hit all those, check all those boxes, and do the research that it takes a lot of time. And so I'm going to start with Cameron again. What have you been able to do? Because obviously, when your hat rack has 15 rungs, how do you delegate some of that effort to get the evidence that you need to provide the proper stuff for the committees to look at?
Yeah. For me, it's realizing the resources that I have available to me, and in a healthy way, making and trying to allow these other people to do some work for me, essentially, is what I'm trying to say. So, you have your vendors at your disposal, and again, it's very important to build that relationship with them, and make them do a lot of the work of providing product information and gathering all that information. And then from an internal standpoint, working with the clinical teams here. As mentioned, I don't have a clinical background, so it's really important for me to connect with those clinical teams and really understand if we already have a product that's similar to what's being requested, or if maybe some of the staff has used a product that's at a previous stop at another hospital, what their experience with that was. So really when you feel like you might be on an island, you're not. You have many resources that are available to you, and you just have to make sure that you're reaching out and trying to involve them in the process. And a lot of times, especially the internal team does want to be involved with that process and learn about all these items that are coming into the hospital and what changes might be being made.
So Liz, I know you have a pretty good team at Parkland. However,
I
you're
do.
still one of the busiest people that I've ever seen. And
Yeah, we
so,
have a lot of committees. We have a pretty big program. I just added another committee. So Parkland's always growing.
right. So how do you delegate? And then tool wise, what do you use?
Well, tool-wise, we have the advantage of having a VA platform, but what I was just speaking with Jason Wright from UT last evening, and we were saying, hey, remember before technology, before VA platforms? So I was telling him about all the resources that I've created. So I have the advantage of, 3 people working for me and with me, entire data team, and a big value analysis process and structure. But starting small and starting wherever you're at is exactly where you're supposed to be. And within this Circle app, I've given you all the tools that you need. What Cameron was just saying, we've got a sample value analysis product request form and a vendor survey. So there's a lot of things on the vendor survey that we went over in detail. Jeff and I talked about it as well. How do we partner with vendors? How do we partner with GPO? How do we partner with our clinicians the best? And all of the tools that we've given you kind of encompass that. A really good start for you.
So during COVID, there was a lot of product outages, and the disruptions have not stopped. They won't stop. It's part of our, culture going forward with the tariffs, et cetera. I know that this platform is going to be amazing for everybody involved here to be able to get on and say, hey, what are you doing about this? What are you doing about this? What are you seeing, Cameron, on your end, and Liz on your end? Start with you again, Cameron. What are you seeing as far as disruptions and how you're, going about looking at trying to, work on those?
Yeah, I think that's an important criteria. When you're looking at a new item to bring into the hospital, it's like Liz said it great it's not only a cost saving initiative, it's, maybe there's product A that's, it might be a better cost saving initiative, but product B is readily available and is ready to bring in, and you might be able to build a better relationship with that supplier compared to product A. And so just making sure that you're, for me, working with your materials management team closely to identify, using supplier scorecards and identifying of possible suppliers that you've already been using, how to filter through suppliers that you might be looking at bringing in, and to really set up and be successful with growing your supply base and doing that in a healthy way without, compromising your supply chain at the same time.
And I would say evaluating when you're looking at the product and looking at partnering with a supplier. One of the questions that I've got on the supplier questionnaire is, where is your company based? Are you onshore or nearshore? Do you have any issues with back orders? Have you had issues in the past? Do you have a substitute product? Like, what's your plan B? And where do you get your raw materials from? So mostly this came up post-COVID. This was actually a really large initiative. In fact, I just got the ARM newsletter this morning, and this is all part of supply chain resiliency. So even the Value Analysis Committee, when looking at products, thinks about the big picture. when we bring this on board, are we going to have problems? How is the supplier performing? What type of issues can I sidestep if I get the right information and make the right decisions up front? Because if you can't get the product or the technology or the service, well, we can't service our customers, we can't take care of our patients. So supply chain resiliency is really important, something that ARM is really focused on, something the GPOs are really focused on, and each and every facility. And on the granular level, that's us, value analysis. We're focused on it as well. Yeah.
So I see that we have a question on the chat from Terry. Physician preference plays a
Actually, Jeff,
significant.
do you mind
Oh, yeah.
calling on Preston first, and then we'll go to the chat?
Oh, Preston had one first. Okay, sorry.
That's fine. Hey, I just wanted to say that what we found was really valuable was that, you know, we always do on a new product a analysis to see if it's going to be profitable for the organization. But we used to just drop it at the end of that and we didn't follow up. And now we stay with it. We check 6 to 8 patients to make sure that we got back the revenue that we expected to get it. Me talk good. That we expected to receive, and it made a difference. We found out that we were putting in a new cryogenic material in the OR, and we found out that the medical record staff didn't know what that was, so they billed it at cautery. So instead of getting almost $1,000 a dose, we got 87. So that was really important that we stick with that and check to make sure that we got what we expected to receive from the insurers. And it wasn't really a question, it was just a comment. Thank you.
Thank you, Preston.
Thanks, Preston. Good seeing you.
And so I'll go ahead and Terry, you had a question about physician preference places a significant part in the decision-making in independent critical access facilities. How do you incorporate that into a program and weigh that against cost and reimbursement criteria? Obviously, Cameron, that would be a good start for you.
Yeah, and we actually have something similar like that going on right now, actually, where we have a new service line that we're starting up, and there were a couple of items that this physician, specifically stated that he's used before, and that's what he would like to use. And so I talked with our team and determined, we actually have something that's very similar to that here. Shared that with the physician, and as it's not too much of a surprise, but came back and said, I actually really like to use what I've already used. Right, so you kind of have that challenge, and from my standpoint, and what I try to do is do that research of, what are really the key differences between what's being requested, what do we currently have, and trying to share that in an unbiased way to the committee and showing, this what's being requested, maybe it does do something better, but at the same time, we also maybe have to buy another component of that that's very expensive, and sharing that with the committee, laying out the financials, the complications of even just storage of those components and items as well in the OR, if we're already stressed on space, and just the redundancy of having a new item that does something very similar to the current item. So again, just doing that research, providing it in a clear way to the committee for them to be able to see and hopefully easily make a decision one way or another, depending on what the committee sees, but you're at least doing your part of doing that background research and presenting that to the committee.
Yeah.
And I just wanted to add to that real fast, because I am also on the committee as part of Montrose Health. And I would say, I think Cameron pointed on this in his presentation earlier, but really that key piece of having the physician there present to present and explain and advocate really helps them feel heard, and also hear the discussion from the committee to say, this was a measured discussion. It's not they're being sidelined, and really have their participation throughout. And Cameron, that's something that you do really well, of engaging with the physicians directly and in email and just tracking them down to get their inputs has been what I've seen. Is they see you as a resource on their side, not someone that's just going to come slash and burn the products that they want for their patients. Liz, you wanted to add to that?
Yeah, I was going to say the background research and work is extremely important. We have the benefit of having 4 nurses on our group, plus But the main drivers are the executive committee who appointed those chairs and co-chairs. And that's who we bring our slides to. We review the opportunities with them a week ahead of time, and everyone gets aligned. So we look at every aspect of the product, and those committees vote. They're the ones that make the decision. And our value analysis committees don't have a problem saying no. And well, sorry, but so the physician will get on the phone, request, and then they'll present their product, we'll go all through the slides, and the physician will leave the call, and then the committee votes. So sometimes in life, the answer is no, and for very good reason. And Cameron putting together that evidence and looking at and comparing the two products, the functionality, the total impact. The basic definition of value analysis used to be, well, if something does the exact same thing with no compromise to cost, quality, and outcomes, or patient safety, quality, and outcomes, and it costs less money, I'll go with the less expensive item. Yeah.
So I think we're
Awesome.
coming
Well,
up
thank
to
you.
coming up towards the end of our time here. I personally want to say thank you to Mark and Preston and Rose for the leadership on getting this put together. As you can see, the content is super valuable. There's going to be many more lunch and learns coming. I don't want to steal Mark's thunder, so I'm going to pass it on to him and maybe Rose. But please, thank you so much for coming, and we look forward to seeing you again soon.
Yeah, just to piggyback off of that, this was incredible. We really appreciate it. You guys taking the time out of your day to join this new initiative. We're hoping to do a lot more of this going forward. We're very open to your feedback. We're consistently growing our leadership teams. There's plenty of ways for you to get involved. But yeah, no, just the utmost gratitude I have for everything that you guys do and for your time being here today. It's most sincerely appreciated. I hope you guys get a lot of value out of it.
So this
Please.
presentation is going to be shared on the circle. So those of you that have a lot of members that are part of your group, and you know who you are, of course, please feel free to share with them. I think it'll be of value to them.
And please feel free to reach out to Cameron or I or anyone on this group with any questions. Connect with me on LinkedIn. I've got my cell, my email there. If you have an issue or a burning question, just text me. I'll call you, and within that same 24-hour period, any way I can help.
Well, this is awesome. Thank you so much, everyone. I'm really excited about this as a launch. I know all of us are, and it's been so great to hear from your questions and see everyone joining. So we will see you on Circle to continue the conversation. Thanks all.
Bye-bye,
Thank
everybody.
you. Great job, Rose.
Thanks, team.
Bye-bye. Yeah, great job, everyone.